Assalamu alaikum wa rahmatullahi wa barakatuh. Today we're going to discuss status epilepticus. Firstly, status epilepticus, by definition, it is seizure activity which is not resolving spontaneously or recurrent seizure without regaining of consciousness in between. It is a medical emergency. What are the etiological factors for seizure? Firstly, non-compliance for anti-epileptic drugs. Following the level of the anti-epileptic drugs steadily will precipitate to seizure. Second, infection. Most precipitating infection for status epilepticus, they are two: meningitis and encephalitis. Neoplasia, the third factor, and the fourth factor, metabolic derangement, hypoglycemia, hyponatremia, and hypocalcemia. How do we diagnose status epilepticus? As we said, it is a medical emergency. So, firstly, by description, by history, taking history, there is description of rigidity, clonic phase movement with cyanosis with loss of consciousness, along with pyrexia and sweating. How do we manage the case of status epilepticus? Firstly, the patient is not breathing, so we will have a special concern on the respiratory system. Ensure airway patency and giving O2 by face mask, checking of pulse rate, blood pressure, respiratory rate, and establishing a monitor EKG to the patient. Secure IV access, and we send the blood for lab investigation for glucose, for thiamine, for urea, electrolyte, calcium and magnesium, liver function test, anti-epileptic drugs level, full blood count, and the clotting secret. Here we have a question mark. Why do we measure the level of thiamine along with the glucose? Glucose hypoglycemia is considered in any patient who is comatose. Okay, we will give the patient glucose in the management along with thiamine. Why not glucose alone? Because giving glucose alone, this will precipitate the patient to have vernix encephalopathy. When we give thiamine, this will eliminate the possibility of acquiring vernix encephalopathy. Okay? If seizure continues for more than 5 minutes, we give diazepam IV, lorazepam, and we will repeat the dose once after 15 minutes. If status is controlled, we will start long-term anticonvulsant drug therapy. One of them will be prescribed: sodium valproate, phenytoin, and carbamazepine. And lastly, thank you for listening.